Hello, I'm Jordan Ghawi, the Texas Emergency Medical Task Force Infectious Disease Response Unit Coordinator. Since September of 2014, when the first patient in U.S. history to be diagnosed with Ebola arrived at Presbyterian Hospital in Dallas, emergency managers have had a heightened concern about high-consequence infectious diseases. And with 43 new infectious diseases jumping from animals to humans in the past 30 years, heightened awareness is appropriate. What is a high-consequence infectious disease anyway? The official definition is any infectious disease that presents an immediate threat, poses a high risk of death or serious long-term disability to a large number of people, and creates a substantial risk of public exposure due to either the disease's high contagion level or the transmission method. That definition is closely tied to the Texas Health and Safety Code definition of a public health disaster. So, does Ebola meet the HCID threshold? Absolutely. Does Zika? No, it does not. Typhoid is not considered an HCID, but plague definitely is. Yes, high-consequence infectious diseases are complicated, but Texas emergency managers are not alone. You have a lot of help. The Texas Emergency Medical Task Force is the emergency aid function for the Texas Department of State Health Services. The effectiveness of the Texas Emergency Medical Task Force has been proven by numerous deployments across the state. So when state funding to help with infectious diseases became available, the Texas Department of State Health Services asked the Texas Emergency Medical Task Force to launch an initiative that would include trained personnel and provide personal protective equipment in order to respond to high-consequence infectious diseases in Texas. The IDRU offers a smorgasbord of options to help local jurisdictions. If a local jurisdiction needs a logistical support only, the IDRU can provide that. If the resource request includes equipment, there are personal protective equipment caches ready for deployment that are strategically located throughout the state. And if the need includes patient care, the IDRU can scale up and provide personnel as well. The personal protective equipment caches, as well as the hospital and pre-hospital teams, align with the Texas Emergency Medical Task Force regions. Cache maintenance and personnel rostering are the responsibility of the EMTF coordinator in each region. The IDRU is not automatically activated by an easy button, however. Before the IDRU gets activated, a lot of work usually occurs, including investigation and testing. For example, a local epidemiologist may be required to study and analyze the distribution and determinants of a possible infectious disease. Once a public health disaster starts to expand and state resources are requested, the Texas Department of State Health Services Health Emergency Preparedness Program, the Texas Emergency Medical Task Force, and the IDRU will be there to help. However, if there was one single takeaway from this video for local emergency managers, it is that the first step to be prepared for high-consequence infectious diseases is to establish and maintain a partnership with your local health department. I cannot emphasize that enough. The IDRU stands ready to assist in successfully containing an outbreak, but one key way to be prepared is to coordinate preparedness and response with your local emergency management and health departments. Thank you.